I just had to have a knife put in my eyelid while I was awake. I don't know how I managed to do that. If this procedure is successful, then I won't have to have eye surgery.
Hi, my name is Jessica, and I really, truly, honestly have no idea what I'm doing. Today I'm here to talk about what's been going on, where I've been. I can't believe I'm making one of those YouTuber videos, but here we are. I just figure, you know, with all the pre-filmed videos I've been putting up, I have not filmed in forever, or what feels like forever, definitely a few months, because of the eye issues that I continue to have. So the last time we talked about this, I told you that I had a Chalazion and I got it lanced and I was using the hot compress thing. Let me tell you all about what's happened since then. So you saw that I was back to wearing makeup for a while. Right now what it looks like, if you see over here, I don't know if you can tell in the camera, you can see like a little elliptical outline of where it was, but it's like 98% flat and it doesn't hurt unless I start rubbing it, like when I do to clean my eyelids at the end of each day. I'll talk about that later on. So really the recovery from this one was really pretty good. I say this one because it was about, I think it was like May 19th or so. No, it had to be a little bit before that. So like a week or so before that. So like mid-May, let's say. I had a tiny Stye right over here where you see the current Chalazion is. Yes, I have another one. It was like right over there and it looked like it was already, I hate even talking about this. This is the part that like grosses me out the most. Coming to a head, like it was going to expel its contents and all that. I hate it so much. So I panicked a little because after everything I went through with this one, I panicked, but it was little, it was already moving through the stages. I knew what to do. I stopped wearing makeup. I did even more compresses than usual because I was still doing compresses for this one to, like, you know, continue to maintain the good health that it's in. And within a week, not even a few days, it was gone. So I went back to wearing my makeup for a day, and that afternoon I started feeling pain over here right where it was. So I took my makeup off, I looked at it, and it was starting to look more like this one had. It was starting to like get red and swell, and it was quite tender. And it was like that for like 2 days. And then this is the part where you might want to not look for about 30 seconds because I'm going to show a picture. This is what I woke up to at 2 a.m. in the morning. So, yeah, it was a quick thing. It progressed quickly and obviously worse than the one that I had before, in terms of pain, in terms of redness, I guess. Not really size, because the two of them, they were about the same size but like different. Like obviously this one I couldn't open my eye fully, so like that was a big problem. I mean, I couldn't with this one too, but you can see how this one was in a sense much worse than the one that I had had. I called up my eye doctor, my ophthalmologist, optometrist, ophthalmologist, they're different. I'm learning the differences now that I've been doing all of this. I called up my ophthalmologist who had taken care of this one, but he was unable to see me because he was doing procedures that day, and the receptionist said you have to see someone because if it's infected it could go into my bloodstream, so that made me feel really good. In case you didn't know already, I have very bad medical anxiety, so these kinds of things that are stressful already for some people are just tenfold for me. So I went to urgent care, and not only did I have a stye, but I had cellulitis in the eyelid. I just talking about this, I still can't believe that all of this has gone on. So they put me on Ceftonir, which is something they use. It's kind of, I don't know the specifics exactly, but it's kind of like penicillin, but they said that people who have an allergy to penicillin can tolerate it usually, which is my case. And thankfully I actually did tolerate this one. I actually had no symptoms whatsoever, no side effects, nothing from that antibiotic, which is really interesting because usually I have at least stomach side effects. But they put me on that and a probiotic. I think I started using Culturelle. I usually use VSL because of my other stomach issues. It's a pretty strong one, but that I had to order. The Culturelle was right there. I knew I needed something, so I did that for like a month, however long it took to go through that package, and then I ordered my VSL and switched back to that. There's nothing wrong with the Culturelle. I prefer going with what I've been on all these years, you know? And of course I was using Tylenol. Like I said, it was painful. Definitely more painful than what was over here. Just looking at myself in the mirror that's behind the camera, I don't know. I'm still processing this whole shebang that's gone on. I went to my ophthalmologist the next day, and he said it was actually improving pretty quickly compared to what usually happens. He also told me that my case was mild, and I just couldn't believe that because I felt like I literally looked like, what's his name, Quasimodo, and definitely felt like it. So I couldn't believe that this was only a mild case of cellulitis, but apparently there's a lot worse out there. Don't look it up if you have bad anxiety like me. Don't look it up. You know I already have looked up some of it. Anyway, the worst of it, I would say, cleared up within 3 days. It was definitely, you know, there was like a little bump left, and it was still a little red, still a little sore, but definitely the bulk of it had cleared up within a few days. I finished out the antibiotic. I did wear sunglasses to work for that next week, partially because it needed to be protected. Definitely you didn't want anything to get in it or like, you know, puncture it or, you know, wind blow anything in it, protect it from the wind, the sun, etc. And also I was so horribly self-conscious about it. I know I showed it to you here. I still don't like that I am doing that, but I figure if this video is going to help anyone, then you need to see what I actually looked like. So to any of my students who are watching who really wanted to know what I looked like that week, now you know. You're welcome. But it was definitely an alarming sight. You know, everyone definitely would have thought I was contagious when I wasn't. It was quite literally an eyesore to look at. Side note, or maybe not so much of a side note because it's kind of important to talk about too, but I didn't know that I had such like self-conscious issues. It takes a lot to embarrass me. It really does. I'm always being goofy and making jokes and whatnot. You've seen some of the makeup looks that I've gone out in, and just kind of going out like, oh well, like it didn't work out, or hey, I like it, so what's the big deal? Or I'll go out and I thought an outfit looked good, and then I look down when I go outside, I'm like, oh, I guess that doesn't match. Oh well, like it takes a lot to get me unraveled in that sense. And I have just felt like so bad about myself and like how I look, and so terribly self-conscious, and I didn't know. I think I mentioned this in the other video too. Like I truly did not know that I was so vain. I didn't know that I was so self-conscious about my face. But I mean, like in the same breath, but can you blame me? I mean, I just want my life back. I want my face back. Yeah. So because it actually cleared up pretty well and pretty quickly, this was like around Memorial Day, and I bought a whole bunch of new eye products, makeup products, because I figured, like with this one, right, the one that had been over here, well, after a certain amount of time, you know, my doctor will give me an estimate, like, okay, 3-4 weeks, and, you know, you'll be back to wearing your makeup and everything. It'll be fine. That was not the case. I went in for follow-up a couple weeks later, and he said while it was doing well, there was still a lot of healing that needed to be done on the inside. So while it looked pretty good on the outside, it was kind of like deceptive to me, because on the outside I'm like, okay, I'm gonna be wearing makeup again soon. He told me no, I wasn't. It had started to, again, I hate talking about this, but I know I have to, because if I'm going to help anyone with my story, I have to tell you what happened. Like a day or so before I went for my follow-up, it looked like it was oozing again. My doctor explained to me the difference between what it was doing then versus what it was doing when it was a Stye, like the week or so before. When it's a Stye, or sometimes the Chalazion as well, when they're oozing and stuff, it's usually pus that's coming out, whereas this is a different substance. It's a thicker, more solid substance due to like remnants of the infection, or at least that's how I understood how he explained it. So two different things that were coming out at two different times during two different stages of the infection, Chalazion, Stye, all that fun stuff. So he told me no makeup on this eye because it was still healing. But the real kicker was that he saw the potential for the same thing in this eye. This eye has been, to this day, I'm going to knock on some wood right now, this one has been totally fine. But what he saw was mild blepharitis, which I'm still working on understanding all of that myself, but he explained it to me kind of like dandruff of the eyelashes. Things are like, the glands are starting to get clogged and can have like little bits of like the dried up oils at the lashes, irritation, and this of course can lead to or progress into this if it's not taken care of at an earlier stage. So to say that I was upset and scared was an understatement, because I definitely, this was bad enough and has been bad enough. I definitely don't want the same issue happening in this eye. And at that point, I begged him. I said, please lance me. I know I was so terrified of the lancing the first time, but at this point, it's not that I'm not scared, but I guess when push comes to shove, that was a better alternative than continuing to go through with this. So I wanted him to cut this one open. Not the big surgery, but the lancing like I had done before when he flipped my eyelid inside out. Took the knife, little scalpel, and just kind of opened it up so that everything could drain out. He told me he couldn't. Actually, I had begged him when I went in with the cellulitis. I was like, please lance this. I'm in pain. It looks awful. I'm so done with this. And he told me I couldn't be lanced because it was too infected, too inflamed, and it would only hurt me. It wasn't going to help me. And he told me the same thing basically when I went back for the follow-up. He said, again, that change in substance, it's not the pus, it's the that like post-infection substance that's different. He said it wasn't going to do anything for me, and that if I really wanted this one to be done, I could keep going with the hot compresses, which I've been doing all this time since early March, or of course the Chalazion removal surgery, which I don't want. So yeah, so I came out of that quite upset. And of course, any doctor I go to, whether it was the urgent care doctor, my optometrist, who has been a literal lifeline for me with all the questions I've been having and helping me try to figure out new things that I can try to avoid this surgery, or the ophthalmologists that I've been to, everyone is telling me that the stress is such a bad thing for all of this. Like, it just increases the inflammation. It can bring it on. And that's just such a hard thing to hear, because I am a very stressed out person, especially when I have, this medical anxiety. I can't even describe to you how bad it's been and how much I've been suffering. And I'm not here to say I'm not stupid. I know that there are so many things out there that are so much worse than this, and I wouldn't be able to handle them because I already can't handle this. It's been really bad, and it's just a vicious cycle, because this causes me so much stress, but then the stress causes it to get worse, and then it gets worse and I get more stress. It's like my stomach issues. The stomach issues, the IBS, cause me more stress, but then the stress causes them to worsen, and it's endless. And this is why I am so tired of all of this. I'm so tired in general. But anyway, so I came out of that quite upset. At that point, my ophthalmologist had diagnosed me with Meibomian Gland Syndrome, if I'm saying that right. No, Meibomian Gland Dysfunction. Basically, the oil glands aren't working properly in my eyes. There's a lot of different symptoms that you can get from it, including like dry eye, lack of tear production, based on things that I've been reading. But it seems in my case, it's this repeated clogging of my Meibomian glands that is causing this. So the Meibomian glands are these like tube-like things that reach from the base of the eyelash, like all the way up into here, like where the crease is. I think there's like 40-ish of them all the way across here, maybe 25 of them or so under here. So they're also here. So this could potentially, again, knocking on wood, this could also happen below. And they stretch quite far, like down to maybe here. So from the base of the eyelash down to here, and then again from here all the way up into here. Both eyes, of course. So this second chalazion was higher up. It's, I don't want to say it's moved, because I don't know, that just gives me the image of it just stands up and moves down. I'm sure it's like traveling through the tube or something. But originally I was almost like a little happier with this one, because you couldn't see it as much because of the location. It was higher up. So, and because of my hooded eyes, for once happy to have hooded eyes, it really hit it for the most part. It's definitely moved down. Like, there was a space where this one, it was always like right on the lash line. This one, there was a space between it and my lashes where now there isn't. I don't know if you can see, like, it's on the lash line now, even though when I close my eye, it's not making the lash line too wonky. This one is definitely different. This one is more outward rather than inward, and there's a lot of different medical terms for all that. I feel like I understand a good deal of it, but I also am not a doctor, so I don't want to give too much information. I don't want to give anything that's not true or false or misconstrued. So my doctor and I had a conversation about something to try to prevent this from continuing to happen. There's a medication called Doxycycline that is commonly used to treat this and prevent it from being so bad. Some people are on it for a short amount of time and that fixes the problem, or at least fixes it for a while, and then they have to go back on again. Some people, they're on it for life. Anytime they try to take them off of it, it comes back. I wanted to try it, and things just really haven't been good for me. I tried the doxycycline like a couple weeks later. I did it on a Friday, and the next day, so the Saturday, the Sunday, and early Monday, I felt a little bit nauseous. A little bit. And I figured, okay, no big deal. It is a medication. It is technically an antibiotic, so it could definitely do that, especially in someone like me. Monday night and through Tuesday, I felt severely nauseous. I thought I was going to throw up like all of the day. And then I got home and I just really felt so awful. And then I took a nap in the afternoon, later afternoon. And by then I was getting other symptoms as well. I was freezing. I was shaking. I was so tired. My stomach was hurting me. I just still can't believe all this nonsense has gone on. I woke up from the nap. I went to my virtual karate class, but I did not partake in it. I just kind of observed and hung out with everybody because I really just felt really awful. And by that evening, I was running a low-grade fever, and I threw up 4 times, but kind of all at once, like one right after the other. And I did feel considerably better after throwing up. So I figured, okay, maybe it's a 24-hour bug. I was hoping and praying that that's what it was. The next day, the diarrhea started. I was so sick. I still felt nauseous. I had the diarrhea. I had the stomach pain. I was so tired. I had no energy, not really an appetite. I felt weak. The chills kept coming. The low-grade fever kept coming. I was out of work for, I think, 3 days. And mind you, this was like early to mid-June, so like the end of the school year, where like, you know, that's kind of like one of the most important times to be present as a teacher, and this is what was going on. I would have waited to try this medicine like after the school year if my doctor hadn't told me about this eye. I mean, not if he hadn't told me. I mean, obviously he has to tell me, but like if that wasn't a concern, if that wasn't an issue, because I really did not want and could not afford to have like both eyes doing something. So the Thursday afternoon, I had decided to go to urgent care because I wanted them to tell me, was this the medicine doing this to me? Was this stomach virus? Those are the two things that I thought it was. And I just wanted someone to tell me, like, what's going on. I had taken the last dose of that medicine on Wednesday, so the day before. Thursday, I just felt like I couldn't get it down. We really didn't know what was going on. So yes, I was still taking this medication through the Wednesday, so Friday to the Wednesday, thinking that I had a stomach virus. I go to urgent care. They tested me for urinary tract infection. That was negative, of course. But upon talking to me and like feeling my stomach and feeling where I was sensitive, they told me that they thought it could be my liver or my intestines or my ovaries or my appendix. And they thought that I should go to the ER right away and have like a CT scan done. Again, maybe this doesn't seem like a big deal to you, but for someone with medical anxiety, being told that something inside you may be really, really wrong and that you should go to the ER and that you should go like now. I cannot describe to you how severe my anxiety was. This is the person that can't get through a blood test, a simple blood test, without a whole ordeal, okay? Without screaming, crying, severe anxiety, passing out. Okay, so to hear all of this was a whole other world. I went home instead. I could not go to the ER. The nurse said to me at the urgent care, she said to me, like, you know, but don't you want to get better? As I was shaking and crying on the table. And I said, no. I said, no, I don't. And she just looked at me so shocked. And I said, I would rather die than, don't take me off of YouTube. Listen, just listen. I said, I would rather die than go to the ER. It's just a testament to how bad my anxiety is. I could not picture the whole thing happening. Anyway, let's try to move off of that. So I go home, complete panic, thinking that, what if I don't make it overnight? Like, what if my appendix bursts? Like, every little twinge that I felt, and I did, I was feeling twinges on the right lower side where the appendix is, and an ovary. I mean, there's all sorts of stuff there, but was I feeling the pain in these areas that they were saying that could be? Yes. I do think, though, that I don't know, maybe they made too much of it. I don't know. Anyway, we're moving past it. So instead, what I did is I made an appointment to see my primary care provider the following day. And when I did that, he checked me out and he said, there's a 97% chance that this is the medication doing this to you. So the doxycycline, the medicine that was supposed to prevent any more eye issues from happening. That other 3%, he said 3% chance that it is my appendix. So that didn't help me too much because, again, with the medical anxiety, it's like even without that, I'm such a stressy person. I am the type of person who needs to hear 100%. So hearing that 97 versus 3, like, my mind is focused on the 3. So he sent me right over to a specialist, a GI specialist, and he checked me out and he said, go home. Go home and relax. It's the medication. Go have some warm broth and go chill out. As if I could relax after all that. So the weekend was spent resting, except when I was what I call anxiety walking. When I was just so consumed by my thoughts, I would tell my mother, sometimes it was like 8 o'clock at night, like it was getting like dark and it was starting to rain or whatever. And I was like, I need to go for a walk now. So she would take me out and I would just keep like walking and walking and walking. And then she would tell me like, we need to go home now. Again, I can't even describe to you how bad my anxiety was and how awful all of this was for me. My students make fun of me because at the same time I was still trying to assign them work and grade their work. I was still having work sent home for me to grade, and I was still giving assignments. I was like typing messages to them like, you know, I miss you all so much. I wish I was there with you. Here's your next assignment. But I had to keep it going, you know. I mean, this is what teachers do, you know. We got to keep it going no matter what's going on with us. So even though I thought I was going to die, I have thought that I'm going to die so many times this year, like due to all this. Like I thought that with the first Chalazion, and realistically, I was not going to die, but like I felt that way. With this, I mean, if it had been my appendix, my liver, whatever, I mean, that's more realistic. I could have potentially died. But yeah, it wasn't that. Spoiler alert. Here I am. It was the medicine. So, and not even like an allergic reaction to the medicine, just a bad reaction to it. I went for a follow-up with the specialist a few days later, and I returned to work. And he said, yeah, it was the medicine. You're fine. You don't have appendicitis. You're good. Like, bye, relax. But it took a while to relax. And it took a while to recover. I do take longer to recover from things. I am sensitive to medication. I honestly did not feel like myself again for like a month. 3 weeks minimum. I feel like closer to 4. I just felt like weak, and it took my appetite a little while to get back to where it was. It took a while for my stomach to get back on track. And again, this is all just made worse by my stomach problems. Anything affecting the stomach is just going to be that much worse for me. So, you know, it was really awful. But to add insult to injury, a few days after I go back to work, guess what flares up again? Yeah. It started to look a little more like what you see now. It definitely started to like swell up again and get like that bump. So I wanted to know what was going on. I wanted to be lanced. Like, no, we're getting this now. We're taking care of it now. I don't want to deal with this. I went to my ophthalmologist and he said it wasn't lanceable because it was really scar tissue from the old one. And he said that basically what happens with this kind of thing is it usually, could it potentially go away altogether with the continued hot compresses? Yes. But more likely, it's going to do this forever, indefinitely, where it flares up, it goes down, it flares up, it goes down. So obviously, no makeup. At this point, I've been given the estimate of 6 months, no makeup, versus at worst, indefinitely. That's a whole other thing. We'll talk about that in a minute. At that point, he officially recommended the surgery to me. Again, coming out of that appointment, just upset was an understatement. I had virtual karate that night, and I cried through half of it. And my instructor was so nice. She let me keep my camera off, and she told me just punch through the crying. It's okay. And everyone's been really supportive. I have to say, everyone has been so supportive. My friends, my family. It's just, this thing isn't going anywhere anytime soon, unfortunately. So I started getting pretty aggressive with the hot compresses, and you could see that I'm like still red, and honestly, it's not so much redness from the Chalazion itself. It's red because I burned myself. This here, the texture has changed. I think, I don't know if that's like scarred now forever, who knows. But this is usually pretty red up here. And I started talking to my optometrist about like different things I could try, different things I could do. So currently, well, let me get to that in a minute. Let me continue this part. So after, I don't know, a few weeks or so, maybe, everything's like all blending into one. It changed. It got bigger. It got white. So I went back to my ophthalmologist, except he wasn't available, and I agreed to see one of the other ones that are there. And that's like a big deal for me because, again, the medical anxiety. It's like once I find a doctor that I'm okay with, I don't want to stray from them, especially if I think something else might need to be done, like, say, the lancing. It's like I didn't want anyone else but my doctor to do the lancing. But this ophthalmologist that he works with is also really nice and understanding of my anxiety. So he looked at it and said what happened was ease up on the compresses because I was scalded. But at the same time, because I was diligent with them, I had brought whatever oils, pus, etc. that did need to be expelled to the surface. The problem was that because of the location, it didn't have anywhere to go. Usually it drains out the bottom where the Meibomian glands end, but mine again was higher at the time. So it couldn't go anywhere. It could potentially just come out the, like, more up in the lid. And he had said, like, we could wait a week and see if it does that. I don't have to jump to a lancing, but I said, no, let's do the lancing. And again, that does not mean I wasn't scared. I was, but I want this over with. And I get so grossed out by it. It's like, if the doctor can do it and take care of it, let him do it, because I just can't. But this one was different. This lancing was different than the first one. This one was more external instead of the internal flip over with the scalpel. This one, he put a needle. I still just can't believe that I've been doing all of this. He put a needle through it, and he got everything out that way. Now, he had told me within a few days I should see like a small improvement, and within a week I should see significant improvement. It looked so much better after, like right after it was lanced. It did. But you could see it's still here. You know, the bump is still here. It looks better than it did, but I mean, we are a week and a half later and it's still here. Let's talk about this lancing. This one hurt. Okay, he put the numbing drops in my eyes. He put the Q-tip with the Novocaine like on it for 30 seconds and waited for that to take effect. But he said the only way to really have that complete numbness is if you inject your eyelid with Novocaine, which is what they do for the surgery. The other one, I don't know why. That first lancing, I really didn't feel anything. I felt like pressure and discomfort maybe, but I did not feel him slicing through me. I felt bad afterwards when everything wore off. I felt like, you know, someone had cut me, which they did. But during, I didn't really feel anything. This I felt. It was like, well, it felt like someone stuck a needle in your eyelid. I kind of felt like, I don't know, getting a blood test done in your eyelid. Again, maybe to some people that's not a big deal. For me, that's a big deal. My mom said I handled it well, though, considering everything. This one hurt. It didn't hurt too much afterwards. Like every once in a while, I would get like a little zing of pain, but not too bad. And I was able to resume like all my activities, whereas the other one, I did have to ease up on the karate for a while. This one, the only restriction he had told me was don't get hit in the eye, which is obviously something you shouldn't do anyway, but yeah. So I feel like the recovery from this one, I guess I can't really talk about the like eye recovery and like the results yet, because I mean, look, if over the next couple weeks this one goes down a lot more like this one had, because this one did take a while, maybe this one will too. You know, I guess I recommend it, but it depends on the location. It depends on whether it's in or out, or there's so many, you kind of don't get to choose your lancing, you know. And obviously I have not given the go-ahead for makeup. Another side note, I mean, this is, you're getting all the real stuff here. I have been buying so much stuff. I've been buying so many lipsticks, lip glosses, blushes, highlighters, whatever, clothes, pajamas, anything, hair things too. I don't have any in today, but I bought like all different colored hair extensions. Like, I've just been buying so many things, and it's not good. I'm going broke. Just to try to make myself feel better in general, feel better about my appearance. Again, right now, I know that it doesn't look so bad. And like, even when it did look worse, like my feelings about it were probably out of proportion to what I actually looked like. But this is taking a toll on me, and on my wallet. I need to not do that. That's I've told you before, that's not an effective way to handle your problems. It's not good. I need to stop. But that's, you know, it's hard because makeup was really a big coping mechanism for me. And it still is, but I can't do with it what I want to do with it. And originally, like, I wasn't doing anything at the same time as the compresses, maybe just listening to like an audiobook, if anything. But now I have been like trying to read at the same time or watch TV, play a one-handed like video game or something to try to stay calmer and not be bored or as stressed when I do them. So, I mean, I'm using one hand and one eye to do them. So anything I do can only take one eye and one hand at the same time. So I can't crochet, that's for sure. I have to do that when I'm not doing the compresses. But, you know, it does affect my coping mechanisms, especially when I am just such a visual person. Like, basically everything is visual for me. Like, all my coping things. I mean, all the stuff I've talked about, reading, drawing, video games, a lot of it is visual. So this has affected me in so many ways. When I had gotten this one checked out the second time, my doctor had said this one was clearing up. But then when I went to get this lanced, the doctor said this one had gotten a little worse again. But he said that with the Blepharitis, that kind of just happens. Like it goes up and down, up and down. Oh, did I ever tell you what I'm doing for the Blepharitis? And just in general. There's a lid spray. I use the Brooder one. I found you're supposed to, according to the box, right? You're supposed to spray it, let it sit there, and then just go about your day or your evening. But I found that was leaving me like waking up with like a dry, I don't know, crust that was like irritating. So I talked to my optometrist and she said to spray it, leave it, and then use like a washcloth, you know, and kind of wipe it with like some warm water. And that, in my case, that's basically how you treat that. So I do that once a night. And you do that regardless of whether you're wearing makeup or not. Now let's talk about this thing here. What have I been doing? I am trying to change my diet, like a lower inflammation diet, which is hard because I like eating all the foods that are inflammatory. And also, like, with my stomach problems, I'm also limited and I'm picky. So it's a difficult change to make. I am having walnuts every day to get the omega-3 to try to lower the inflammation. I don't like walnuts, apparently. I thought I did, but apparently I only like them in like banana nut muffins. Not to just sit and eat them straight out of the thing, but I'm doing what I have to do. Blueberries, which for some reason my stomach doesn't like them, so I'm trying to, you know, keep introducing them to my stomach so that I can handle them. Sucks. Strawberries, potato, I'm trying. And then something else my optometrist recommended is omega-3, like the fish oil supplements, also with curcumin. I don't know how you pronounce that, but it's like something found in turmeric, which is supposed to, again, lower the inflammation. Actually, it's photo time. Look at the size of this monstrosity. So, yeah. I'm not a bad pill taker, but like the size of that thing, like, really just floored me. But it hasn't been bad to swallow. It really hasn't. I don't know how, but it hasn't. I've only been on it for a week so far. So like these other changes that I'm trying to make, also like walking 20 minutes a day, all these like more, what would you say, holistic changes to try to lower the inflammation, to try to prevent future ones and to try to lower this one. We're not going to see the results of that, if there are any, for a while. But I'm just letting you know what I'm trying right now, what I'm doing. So this pill, I had to start off every other day. I'm going to start now taking it every day and see what happens. The problem is, again, my stomach. So the first day, I didn't have a great reaction. I didn't feel well. I had like sharp pains in my stomach. I had to go to the bathroom a few times. It wasn't diarrhea, but I had to go a few times. And like I said, my stomach just hurt and I felt awful for like, I don't know, 4 hours. So my optometrist said, okay, you know, instead of just giving up, try it every other day first. So take a break tomorrow, try it again after that. And that has worked. I've been tolerating it now. So now I want to try to move up to every day. So today is going to be my first day doing that. I took it yesterday. I'm going to take it today. I'm taking it with food, as much food as possible, to try to reduce any side effects. Like I said, I can't tell you much more than that. The ones I am using are the Nordic Naturals ones, the omega-3 and curcumin. They taste like lemon. I've heard some pretty awful things about other fish oils and stuff. I mean, I would throw up. I don't like fish. I don't like anything from the ocean. I don't even like sea salt, okay? So, if they tasted like what they are, I wouldn't be able to do it. I would be vomiting every time. So the lemon, I'm happy for the lemon. Now, I feel like the most important thing is, like, you can't psych yourself out about the size of these pills, because you're just going to make yourself choke. They're really, truly, they're not that bad to swallow. If you're a bad pill taker, then I'm sure that's going to be difficult for you. But if you're not, you don't psych yourself out about it. Just, you gotta take it, you'll be fine. Oh, and wearing sunglasses whenever I go outside, which, I mean, is probably something you should do anyway, but apparently this dysfunction does cause light sensitivity, and again, just further protection for your eyes, like overall health in general, and for the specific Meibomian Gland Dysfunction. I have been feeling the light sensitivity more so in this eye than this eye, which makes sense. That's another thing I bought. I bought a million pairs of sunglasses to change out with my outfits. But I do need them, but you know, I have a lot of them. Oh, and another thing I've been doing is I've been using blue light glasses to just protect my eyes from further strain, and also like to try to blink enough. My optometrist was telling me about that. Like, it keeps the Meibomian glands active, prevents them from like drying out more. I mean, it's not like a magic fix, but just something to, like, all these little things add up to like help. You know what I mean? Really, I should be wearing the blue light glasses now while I film. So all of this, I'm trying to avoid surgery. I have thought about it a lot. I've researched it a lot, to the point where, I mean, it's unhealthy for me to do. You know, it does nothing to help my anxiety whatsoever. It just makes it so much worse. I've been moping around the house. I've been super duper stressed out. This summer has sucked. I was hoping to really have a nice summer after my first year of like full-time teaching, because I really could have used a fun, happy, relaxing summer, but that's not going to happen. I've been spending it taking care of my health, and trying to do things for it. So this surgery, I can't see myself going through it, because it's like 5 to 20 minutes long. You're awake for the entire thing. The things that could go wrong, I know those are probably small, but hey, my track record isn't so good. And that anxiety. So, and then there's the recovery. I mean, they say it looks a lot worse, like, before it gets better. And you could, like, be in, like, not in recovery as if, like, you have to stay in bed, but, like, you know, the healing process could take, like, a whole month. And, I mean, maybe, I don't know, maybe that's not such a big deal in the scheme of surgeries, but I mean, I have the time to do it right now, being, you know, a teacher and being off on summer vacation, but there is no, like, aside from just me thinking, I don't think I could do this, there's no medical necessity. Like, it's not medically necessary for me to have this surgery right now. If I were to do it, it would be a preventative and mostly just cosmetic thing, because, like, I'm just so over this. I want it done with. I want to wear my makeup again. But I just keep thinking, like, what if things get worse, like, because of the surgery? What if I have a complication? Like, what if I get it, like, I don't know. And that I did it, what if I lose my vision? Like, what if they poke me? I don't know. All these different things. These are the things that go through my head. I mean, they are possible, but I don't know. I just feel like a surgery is a big decision, even if the doctors think that like a surgery is not such a big deal of this caliber. For me, again, this is a huge deal. And I mean, I have to say, I've been watching videos of people on here too who are makeup lovers and who have done it, and they say too, like, it's a very nerve-wracking thing. So I'm not alone, even if I feel like it. I'm not alone in my situation or in my anxiety about it. But I just think, like, if I do this for cosmetic reasons and something goes wrong and I make the situation so much worse, that's going to be really bad. It would be one thing if I had like a huge one, please, knock on wood, or if I was having like recurrent infections, again, knock on wood, if I was in like a lot of pain all the time, or I don't know, if there was some kind of like severity, if it was affecting my vision, if it was putting pressure on my actual eye, I feel like those would be much better reasons to do this surgery, for me anyway. And like, you know, to risk all the stuff that comes with it. I don't know. I flip back and forth about it. Sometimes I think like, well, how bad could it really be? But even my doctors admitted to me that the needle that they put in you to numb you is bad. So I don't know. I think what I should do is go for a consultation with the surgeon, just to talk to him, see what he thinks, have him talk about the procedure, and like have him evaluate my actual situation. Maybe he would say, you know what, yours is like really small compared to what I work on. I think you should leave it alone and keep trying the hot compresses and hang in there another few months and see what happens. Maybe he'll say, because it's really small compared to what he sees, like, you know, this surgery will be a cinch. Let's do it. I don't know. I think that's what I should do instead of keeping my mind guessing. I think I should go for a consultation and see what he says about my actual situation and what will actually happen. But I haven't done that yet. I think I should. I don't know if I will. Yeah. Let's see. The makeup thing. Again, I know logically there are so many worse things in the world, but you know, the eye makeup is just such a passion of mine. It was my daily solace, my daily hobby. I have so much of it. It's very upsetting for me to not be able to use it and like to be afraid. Like, I'm afraid to even put makeup on this eye and still do like videos, because what if something happens, God forbid, on this one? Then I have two like this. If I didn't have the blepharitis on this side, but I mean I do, so I don't know. I don't plan on leaving here. I mean, I'll do like lip and cheek videos, but you know, that's not as much fun, at least for me. I think of all the people who have it so much worse. This has just been ongoing for 4 months. I'm tired of it. I'm tired of trying different things. I'm tired of dealing with it. The compresses take up time and I burn myself. I can't even picture like people who have cancer and like how drained they must be from like treatment, because I'm so drained mentally from all of this. I can't imagine how much worse it is, like 1,000, a million-fold, for someone who has like a serious problem, because this is not serious. It feels like it to me, but it's not in the grand scheme of things. So I'm so tired. I'm drained. I'm done. I'm over it, but still too afraid to have surgery. So this is where we are right now. And I'm pretty calm right now talking to you about this, only because I have bigger problems now. This is not the first time I've been in this kind of situation. Unfortunately, one of my pets is sick and things don't look good. So ever since that's happened, which is pretty recent, only a week and a half, it's like I don't even care about this anymore, which made me think like maybe now is when I should get the surgery, when I don't care so much. Maybe I won't be as afraid. I did try recently a medication to see if I could, that could make the surgery easier for me. My doctor recommended I do that, to experiment a little bit with that, because if I do choose to do surgery, I am going to need some kind of sedative to knock me out or make me calm, because I can't. I'll be in there, I'll be like moving or something and they'll stick me in the eye, something like that. But I've only tried it once so far. I didn't like how it made me feel, so I don't know. That's another thing I'm experimenting with that I will have to update you on. But that's one thing I'm thinking. Should I just do the surgery now while I'm not as concerned about this? I have bigger problems. I'm ready for this year to be over. I'm ready for 2023 to be over. This has been an awful year in terms of medical things for myself and others. Pray for me, please. Whatever you believe in, I don't care. Send me your good vibes, your good wishes. Keep me in your thoughts. I pray for all of you guys. I think about, who else maybe is watching and struggling with either similar issues or different issues, no matter what is going on. I just want everyone to be well. I want everyone to be happy. I want to get better. I want my pet to get better. Neither looks like it's going to happen. If anything, I'll probably be better and he won't. I'm so done. I'm so over this year. I hope you're doing well. I really, truly do. I hope someone out there is having a fantastic 2023. It's not me. I hope it's you. Whatever you're dealing with, hang in there. Know my thoughts are absolutely with you. This was a very long video updating you on all my adventures. I hope that the next time I see you to talk about this kind of thing, that I'll be wearing blue sparkly eyeshadow and that I'll be happy and stress-free, and maybe that's a pipe dream, but that's what I'm hoping for. All right, that's it for today. I hope you have a good day no matter what it is you're doing. Bye. See you next time.